Hi, I'm Dr. Cary Mielke, Chief of Staff at Shriners Hospital for Children, Twin Cities. Limb lengthening is a procedure where we're able to deal with large limb length discrepancies by lengthening limbs. And the way this is reserved for patients with over 4 or 5 centimeter leg length difference, and for patients that are able to tolerate the technique, the surgery, and the extensive rehab that's needed during and after a limb lengthening procedure. So there's an extensive evaluation of patients even before we offer this to make sure they know what to expect and all the various rehab and exercises and everything that will need to be done. There are 2 main techniques currently to do limb lengthening, each with their own indication. The classic style was done with external fixators, or so-called a Lizaroff technique. Nowadays that's done with fixators that are essentially our rings that have 6 struts attached to them, and these external fixators are attached to the bone that you're going to lengthen with either pins or wires that actually attach to the external fixator, go through the skin, and attach to the bone. And so the actual procedure at surgery, you apply the external fixator, and once it's applied, you then cut the bone that you're going to lengthen. And then there's a period of time where we let the bone heal. So usually we wait about a week, and then after a week, we slowly distract through the healing bone, and that lengthens not only the bone, but the other structures, the muscles, the ligaments, the nerve, the artery. Because of that, we have to lengthen slowly, only about 1 millimeter, sometimes less than 1 millimeter a day. With the external fixator, there's a computer-assisted program where we tell the computer where the cut bone is within the frame. We tell the computer how much length we want, how much angular correction we want, how much rotation we want, and then the computer spits out a program to the patient outlining the turning schedule, and they turn the struts daily to accomplish this. And so if you have a 5 centimeter lengthening or 50 millimeter lengthening, that's 50 days minimum in the external fixator, and then usually another 2 days minimum for every day of lengthening, so another 100 days in the fixator. So these children are 150 days or longer in fixators because they have to stay on until the bone is healed well enough to remove the fixator. There's a lot of therapy associated with maintaining hip and knee range of motion or ankle range of motion, and it's appropriate for people that have large angular or rotation correction as well as lengthening. A newer technique that's come on the scene in the last 5 years or so is a magnetically driven lengthening nails that are inserted at surgery completely within the bone. They're fixed at either ends with screws that attach the bone to the rod, and the rod itself has an internal mechanism, a motor if you will, that can be driven by an external magnetic field. So we apply a device to the area of the rod where the motor is, and then again, lengthening 1 millimeter a day, we set up an external magnetic field using rare earth magnets that drive the motor in the rod to lengthen the leg. The most appropriate patient for this are straight lengthenings that don't have any angular correction. We find this technique is tolerated quite well by the patients, better than the fixators. There's less pain. The therapy seems to be easier, and they're maintaining their range of motion of their joints better, but it's still lengthening. There's still a prolonged period of time non-weight bearing or minimal weight bearing until the bone is well healed.